Emotional symptoms, propensity to worry. Many patients complain of propensity to worry and overthinking, pensiveness. And even if it is not the presenting condition, many people profess to it when asked. The emotion of worry is related to the lungs, and overthinking, pensiveness, is more related to spleen. Worry describes a condition in which the patient is prone to imagining the worst possible outcome in a certain situation. For example, a mother imagines that her son has been in an accident when he is late arriving home. Overthinking describes a state in which the patient is unable to empty the mind of repetitive thoughts, which may be of relatively trivial nature. Molehills may become mountains in their minds when an apparently insignificant issue develops into a cause of great concern. A propensity to worry and overthinking is most commonly caused by and may in turn cause an empty condition. A deficiency of spleen chi and or blood is the most commonly seen pattern leading to worry and overthinking. However, heart and or liver blood deficiency also may lead to excessive worrying. There are also situations in which overthinking is caused by a mixed or full condition, namely stagnation of lung qi or yin deficiency and empty heat. Worry from a full condition is usually more intense and consuming than from an empty condition, which a patient may describe as being more lurking in the background. Lung qi deficiency. Worry, depression, dislike of speaking, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating, bright white complexion, propensity to catching cold, tiredness, dislike of cold, pale tongue, empty pulse. Acupuncture, lung 9, lung 7, stomach 36, lung 12, lung 3, do 24. Heart and spleen qi deficiency. Worry, slight obsessive thinking, slight depression, overthinking, palpitation, shortness of breath on exertion, pale face, tiredness, spontaneous sweating, poor appetite, slight abdominal distension after eating, weakness of the limbs, loose stool, pale tongue, empty pulse. Acupuncture, heart 7, run 14, stomach 36, spleen 6, run 12, do 24. Lung qi stagnation. Worry, mild irritability, depression, feeling of lumps in the throat, difficulty in swallowing, feeling of oppression or distension of the chest, slight breathlessness, slight sighing, tongue slightly tight on the right front position. Acupuncture, lung 7, lung 3, pericardium 6, stomach 40, and do 24. Heart blood deficiency. Worry, depression, insomnia, poor memory, anxiety, dream disturb, sleep, propensity to be startled, palpitation, dizziness, dull pale complexion, pale lips, pale and thin tongue, choppy and fine pulse. Liver blood deficiency. Worry that increases after the period in women, dizziness, blurred vision, floaters, numbness of the tinkling of the limbs, scanty menstruation, dull pale complexion, pale tongue, choppy and fine pulse. Heart yin deficiency. Worry, insomnia, dream disturbed sleep, poor memory, anxiety, propensity to be startled, mental restlessness, unease, feeling hot and bothered, palpitation, dry mouth and throat, light sweating, normal colored tongue without coating, or with rootless coating, floating empty pulse, especially on the left front position. Heart yin deficiency with empty heat. Worry, especially in the evening. Insomnia, dream, disturbed sleep, poor memory, anxiety, propensity to be startled, mental restlessness, unease, feeling hot and bothered, palpitation, dry mouth and throat, thirst with a desire to sip fluids, feeling of heat in the evening, malar flush, night sweating, five palm heat, red tongue, breather on tip, no coating, floating, empty and rapid pulse. Clinical note, worry is one of the most pervasive emotional causes of disease in Western patients. It affects the lungs and heart, and it causes pathology of the chest and breast. Remember that worry also affects the liver, and it may cause liver cheese stagnation or liver yang rising. Overthinking. Heart and spleen chi deficiency. Worry is slightly obsessive thinking, slight depression, overthinking, pale tongue, and empty pulse. Lung chi deficiency. Worry, depression, pale tongue, empty pulse. Lung chi stagnation. Worry, mild irritability, depression, a feeling of lump in the throat, tongue slightly red on the side of the chest, area pulse very slightly tight on the right front position. Heat blood deficiency. Worry, depression, pale and thin tongue, choppy and fine pulse. Liver blood deficiency. Worry which increases after the period in women. Pale tongue, choppy or fine pulse. Heart deficiency. Worry, insomnia, dream disturbed, sleep, poor memory, anxiety, propensity to be startled, mental restlessness, uneasiness, feeling hot and bothered, floating empty pulse, especially on the left front position. Heart deficiency with empty heat. Worry, especially in the evening. Anxiety, propensity to be startled, mental restlessness, unease, feeling hot and bothered, red tongue, reader on the teeth, no coating, floating empty and rapid pulse. Thank you for your attention.